Now codeine. Codeine is a naturally occurring opioid and a weak analgesic compared to morphine. So it is used for mild to moderate pain. And it is derived from its morphine by CYP2D6. CYP2D6 activity varies among patients. Life-threatening respiratory depression and death have been reported in children who receive codeine. Now dextromethorphan, it is a synthetic cough depressant and has relatively no analgesic effect. Now oxycodone and oxymorphone. Oxymorphone, they are orally active semi-synthetic analogs of morphine and codeine given parenterally is approximately 10 times more potent than morphine. Interactions occur due to CYP450 enzyme system. Extended release formulation is also available. Now hydromorphone and hydrocodone, orally active semi-synthetic analogs of morphine and codeine. Oral hydromorphone is 4 to 7 times more potent than morphine. Hydrocodone is the methyl ether derivative of hydromorphone but is a weak analgesic than hydromorphone. One of the hydromorphone is where action of CYP2D6. Now fentanyl. Fentanyl is a synthetic opioid chemically related to meperidine. It has 100-fold analgesic potency of morphine and is used for anesthesia and acute pain management. IV, epidural, intrathecal. It is a local anesthetic to provide epidural analgesia for labor and post-operative pain. Fentanyl is metabolized to inactive metabolite by CYP434A. Now sufentanil, alfentanil, remifentanil and carfentanil. These are synthetic opioid agonists related to fentanyl. They differ in potency and metabolic disposition. Now methadone. Methadone is a synthetic orally effective opioid with equianalgesic potency compared to that of morphine. Methadone may also be used for opioid withdrawal and maintenance therapy in the setting of prescription opioid and heroin abuse. The withdrawal symptom with methadone is milder but more protected than that with other opioids. Methadone induces less euphoria and has longer duration of action than morphine. Long half-life ranges from 12 to 40 hours. Despite this, the duration of analgesia is just 4 to 8 hours. It can produce dependence like that of morphine. It is neurotoxic. It is less than that of morphine and it can prolong QT intervals. Meperidine is a lower potency synthetic opioid structurally related to morphine. Now with some mu agonist, meperidine is very lipophilic and has anticholinergic effects resulting in increased incidence of delirium. Normeperidine is renally excreted. Now due to short duration of action and potential for toxicity, meperidine should only be used for short term, 48 hours.